Hello, good evening. Is there anyone with me today? Good evening. INICET May 2023 recall session psychiatry. Today, actually, I wanted to do recall, so that's why I'm here because this is the first time in the history of INICET since the INICET started from November 2020. I have got 11 questions related to psychiatry and psychopharmacology. Even if I ignore the three overlapping questions with pharmacology, I still have 10 questions related to core psychiatry this time, or maybe like 8 questions because there are total 11 questions and 8 questions related to psychiatry and 3 questions related to pharmacology. So, do I have any student with me who can help me with the recall? Because some questions I have already recalled on WhatsApp, Telegram, Facebook, and some questions I need help where you people can help me in the recall. So, if there's anyone available in the chat, you can help me with that particular recall. Yes. Do I have any student here who has appeared for the exam today so that it's easy to discuss? I have compiled a PDF and some of them are partial recalls, some of them are complete recalls, and I have shared that PDF in the DAMS-eMedicoz official group on Telegram just 10 minutes back from now. Have you seen that? If not, you can see that right now so that you know that whatever I am discussing on YouTube, that PDF is already there with you on the Telegram group. So, shall I begin? Are you here? Alright. So, the first question was which of these are the causes of reversible dementia? It was a multiple choice response type question, and one of the choices was NPH, which is a reversible dementia, non-nutritional hydrocephalus. Hypothyroid, which is a reversible dementia. Lewy body is not a reversible dementia. Vitamin B12 deficiency is a reversible dementia. So all except C seems most suitable answer here. All except C seems most suitable. This is the question that I have a complete recall of with all the 4 choices. If anybody wants to suggest any edits in this question, you are more than welcome. Do you have any suggestions, any editing for this one? Any suggestions, any editing for this one? Thank you, Piyush. Okay. Second question. SCOF criteria questionnaire is used in the evaluation for. SCOF is a screening test. Okay. Have you ever felt sick? Have you ever lost control? Have you ever felt fat? So it is for eating disorders. The other options were sexual disorder, behavioral disorder, mental health. So it was for eating disorders. So these two questions I had full recall of available. Any suggestion, any edits that you would like to recommend? Okay, next question. Now this question we all know the answer is trofinetide because we have checked it on Google, and it's a new drug approved in March 2023 and asked in May 2023 exam. But I still don't have the other options available. Does anyone know the other options that were asked? Does anyone know the other options that were asked as choices? Anyone of you knows the other option that were asked? Sparsentan. Okay, noted, noted. Sparsentan noted. Apart from that, any other option that you remember? Anyways, the answer was trofinetide. Okay, so the recently approved drug by FDA for the treatment of Rett syndrome is trofinetide. A few students have marked this correct who are aware about the recent updates. Quite a few. So the other two options, none of you remember. Okay, I'll wait. Whosoever remembers, kindly ping me up. Labile indifference is seen in. So after I shared the PDF, some student messaged me this mania, schizophrenia, depression as the other options, but the answer is very clearly conversion disorder. Was it a straightforward one-liner? Was it a straightforward one-liner, or was it a clinical question? Was this a straightforward one-liner or a clinical question? Okay. So are the options recalled here correct? Mania, schizophrenia, depression were the options. Were the other options mania, schizophrenia, and depression were the other options? Were you able to mark this correct? Were you able to mark this question correct? Labile indifference, for those of you who do not know, is its lack of facial reactivity to the suffering. Okay, Piyush, you are saying the other options in the Rett syndrome question were LAS, Meditam, and Erenumab. I don't even know what are these drugs. So I think this question should be going to pharmacology now because I don't even know what are the drugs you are talking about. But I'll write it so that for the purpose of completing the recall, I am hearing these drugs for the first time. Erenumab. Okay. I'll read about them. If you are saying I will read about them. Erenumab. Fine. Let's come back to my psychiatry questions. Okay, tactile hallucination. Were you able to mark this one correct? Was the question like this? Tactile hallucinations seen with the use of cocaine are known as straightforward question. Some questions were very straightforward. Tactile hallucinations seen with the use of cocaine are known as straightforward question. Formication. Dipsomania is compulsive drinking of alcohol. Dipsomania is compulsive drinking of alcohol. What was the fourth choice? Anybody remembers of this question? Oniroid is a waking dream-like state. What was the fourth choice of this question? What was the fourth choice of this question? Anybody remembers? Nobody remembers? Fine. I'll leave it blank. Rectal hallucinations seen with the use of cocaine are known as formication. Dipsomania is compulsive drinking of alcohol. Oniroid is a waking dream-like state in which the person is confused, disoriented. I hope you were able to mark this one also correct. Priapism is a very famous side effect of trazodone. This question is there in DQB also, Psychiatry QBank also. Again, I could not recall the fourth choice. Were you able to mark this one correct? Fourth option was bupropion. Okay, thank you, Kushavasti. I was waiting for you, Kushavasti. How was your exam? You completed my question number 6. Thank you. Question 7. Was it a straightforward question? Clozapine therapy, granulocytosis. The patient should be monitored for granulocytosis because whosoever has recalled me the question has only given me granulocytosis. Myocarditis. Okay. Cerebral bleed. Suicidal tendencies. Okay. Rather, this your uh, clozapine decreases suicidal tendencies. Thank you. Answer is granulocytosis only. Thank you for recalling the choices. I really appreciate it. Clozapine is a drug known to cause granulocytosis, and that's why we monitor the blood level count, mainly your total leukocyte count, differential leukocyte count, and to be more specific, absolute neutrophilic count. If the total leukocyte count goes below 3000 or absolute neutrophilic count goes below 1500, we have to stop clozapine. Thank you so much. You completed the question. Thank you so much. You can take a snapshot of this question if you want. Last low mood, last few months, decreased personal hygiene. So this is a case of depression. So case of depression with I am dead means nihilism. As simple as that. Cotard is nihilistic delusion without being depressed. It's a straightforward question. I have discussed with my colleagues psychiatry faculties and we all are convinced that the final answer is nihilism. Let's avoid controversy here. It's not Cotard, it is nihilism. All my co-faculties at different other platforms are convinced, and the answer is nihilism. We discuss among us also. We are good friends, so answer is nihilism. We all are convinced about this. Depression with delusion, I am dead. It is nihilism. I don't have a head. Nihilistic. Were you able to mark this correct? Are the options correctly recalled? History of depression was given. Decreased interaction. Some students were saying decreased interaction was also there. Now comes the problematic part of the paper. alcohol. Question 9, 10, and 11. Not even 10. These are the problematic part of the paper because I could not get the correct recall of this. Now, examination of drunkenness. This is something you have not studied. This is something we don't teach routinely. I accept that I haven't taught this examination of drunkenness. First of all, drunkenness examination is not a purview of psychiatry because this patient under alcohol intox does not come under psychiatry mostly. It comes under casualty, emergency medicine. We see more of alcohol withdrawal rather than alcohol intox cases. But still, first you read the question. Is the recall correct? During examination of drunkenness, patient smell of alcohol, has red eye, but during examination is conscious. Motor coordination is normal. He can walk in straight line and can talk normally. Patient has not taken alcohol. No, he has taken. Patient has taken alcohol and is not under his possession. No. Patient has taken alcohol and is under possession. Patient has taken alcohol. That's for sure. But it is under possession or not under possession? What do you think? There are certain blood levels. One standard drink increases your blood alcohol level by 15 milligram per deciliter. First, you tell me, are the options recalled correct? I will give you a detailed version of this complete topic, maybe tomorrow or day after tomorrow, with all the references and all the proper theory discussion. I'm yet to go ahead, with the proper reference of this complete topic. So just give me some time. Let me give you with the proper references. Then I'll give you the proper answer of this question. It would be too early to comment upon the answer at this time because there is some language catch in this question. You just tell me, are the options correct? All of you tell me, are the options correct? Was it possession or was it influence? Piyush is saying under influence. I also believe influence is a better word. Influence. Correct. Thank you so much. I'll get back to you with the answer of this. Again, this question recall lithium I want from your side. Some students were saying this was multiple completion correct type of question. Multiple correct type of question. Fine tremors are seen at therapeutic blood level. That is true. Single best. Single best would be this. Was it true was asked or not true was asked? True was asked or not true was asked? Okay. It does not cause teratogenicity was option. Lithium is not absorbed from the gut or not effective orally. What was the option? One student has messaged me, sir, not absorbed from the gut, and one student has messaged me, sir, not effective orally. What was the option according to you who are attending my session live? Not effective orally or not absorbed from the gut? Is option D correct? Approved for absent Caesar? Okay, thank you so much. Then answer is A, beyond doubt. Fine tremors are seen at therapeutic blood level and coarse tremors are seen at toxicity. Last question, 11. Now this somebody said that it was multiple correct type. This is the last question, last 2-3 minutes. Which of the following is included in the criterion of substance dependence? Multiple correct type. What was the question? Substance dependence or substance use? What was this question exactly? Was it criterion asked or was it criteria was asked? Was it something like all are correct? Prefer substance above other activities because this is also a criteria. Was there any option like all are correct? Because the criteria of substance abuse are 11 points are there. This is this year TND question paper. Gradually increasing amount of substance, neglect of other activities, spending most of the time in procuring the substance, neglect of other activities, all are correct. Use of substance in physically hazardous situation, use despite physical harm, tolerance, craving, withdrawal, all. There is a 11 point criteria. According to me, all are correct. So I've given you answers of all the questions except one that I have to check drunkenness criteria. Apart from that, we have completed almost all the questions. One option of question number 5 is remaining. Then one option of question number 3 is remaining. That is pharmacology question now. Other than that, I have given you answers of almost all the questions. So, what do you think? Out of 11 in psychiatry, one I have kept as a disputed question. How many you got correct? So first time we have 11 questions in psychiatry. I'll compile all these and make a proper video with explanations and put it on eMedicoz app. Thank you very much for participating in the recall session. With your inputs, I am able to recall all the options and questions and answers correctly. Thank you so much. Hope it helped you and it definitely kind of helped me. Thank you. That's all for the day. Bye bye. All the best for results.